So today we're gonna talk about menstrual cramps. What are menstrual cramps? Why they happen? Why some people have worse cramping than the other people. So to understand what menstrual cramps are, I want to take you to the model of a uterus so I can explain how the menstruation happens and why you get the cramping. Okay, so this is a model of the uterus which shows like a cut section of the uterus. So this is the uterus, cervix here, tubes on the side, ovaries here, and this is the lining of the uterus. So when you have menstruation, what comes out is this lining of the uterus. So when the menstruation is happening, this lining of the uterus makes a hormone called prostaglandin. The job of this hormone, prostaglandin, is to make the uterus contract. So this uterus is made up of, we call smooth muscle tissue. So this is the wall of the uterus, which is made up of smooth muscle fibers. So this prostaglandin from this lining gets in here into the wall of the uterus and it makes it spasm. So with the spasming, two things happen. Number one is there are blood vessels supplying the blood to this muscle layer of the uterus. Now because of the spasm, what's happening? They're getting closed off. So there's no blood going to this muscle fibers. There's no oxygen going to this muscle fiber. So they start hurting. That's what the cramping is. The second thing happens with this spasm is the lining of the uterus starts coming away from the wall of the uterus, starting your bleeding. So prostaglandin produced by this layer is the cause of your cramping. Now, some people have it more than the other. Why? Because of two things. It depends upon how much spasm is happening up here. And number two, whatever is separated into this uterus, into the lining, has to come out, right? It has to come out of this cervix. Now, if there's an obstruction, if it is a very narrow cervix, the blood is not going to continue to come out quickly. So what will happen to this blood? It will all sit here. And so as it sits here, it's going to make clots. Now these clots are sitting in the uterus. The muscles are saying, I don't want anything in here. It has to come out. So they have to push these clots out. So have you noticed that when you have large clots or you're passing clots, you have more cramping? Yeah, because these muscles are cramping and this is how it is coming out of it. So that's the reason why people have the cramping. Now you can feel the cramping in the lower part of your belly, in the lower back. Sometimes people have nausea with it, vomiting with it. Sometimes people get headaches, breast tenderness, and sometimes they say, oh, my pain goes way down my legs as well. Why? Because the nerve supply to the uterus is same as the nerve supply to this lower part of the body as well. So your pain gets transmitted that way. Now, menstrual cramping is very common, okay? 80% women who have menstrual cycle have some form of cramping. And everybody's different. Some people get the cramping before their menstrual cycle start. So they know, oh, my cramping is here, my period is coming. Some people get the cramping during the menstrual cycle when they are bleeding, especially when they are bleeding heavy and passing clots, and some towards the end of the cycle. So everybody is different. But most of this pain is mild enough that you can either use heat, you can use Tylenol or Midol or some kind of an ibuprofen, and it will get you some relief. Now the way ibuprofen works is because it works through their hormone prostaglandin I just told you about. It decreases the amount of prostaglandin and you feel better. Now if you have done all these things, you have used heat, you have used ibuprofen or Tylenol over the counter, and your pain is not going away, then will be the time to see your gynecologist. And what they will do, they will obviously do an investigation to make sure there are no other reasons why you're having pain. because the normal cramping we call dysmenorrhea, which I told you is in 80% people, is the commonest reason for pain. But there are other things like endometriosis, scar tissue from previous surgery, fibroid tumors, ovarian cyst, which also can cause the pain, or it could be first sign that something else is going on than a normal cramping. So they will check you for all that, and depending upon what they find, they will treat you. Sometimes putting you on a birth control, like a birth control pills or a patch or a ring, something like that, will also help with the cramping. So there are treatment options. There's no need to suffer. Try your home remedies first, but if it's not getting better, definitely go see somebody. And I hope this video helped you, a little explanation of why the cramping happens. But if you still have more questions, please contact me. My information is down below, and you can email me, you can message me on Instagram or on my Facebook. I'll talk to you guys soon. Bye-bye.